Hi everyone, welcome to researchmd.com. We got a great presentation today. We're going to teach you all about Trastuzumab associated with the cardiotoxicity. Again, my name is Pramil Cheriyath. I'm a program director, internal medicine, transitional residency, director of research, and I'm an assistant professor of medicine, two large medical schools, and director of research also. So let's get into our topic. So the drug we're going to talk about today is Trastuzumab, and what is the trade name? HERCEPTIN, okay? When do you use it? Invasive breast cancer that overexpress HER2. So HERCEPTIN is the drug. It's a recombinant humanized monoclonal antibody that binds to the extracellular juxtamembrane domain of HER2 and inhibit the proliferation and survival of the HER2-dependent tumors, okay? So it's a humanized monoclonal antibody, remember that. So what is why are we talking about today? Because of what? Very significant cardiovascular adverse effect, okay? Cardiac arrhythmia 3%, but look at the left ventricular cardiac dysfunction, right? Or 5%, like almost up to 18.5%. Heart failure and the left ventricular cardiac dysfunction. Myocardial ischemia also it can cause. So cardiac assessment. So what do you have? Of course you have to do the history, physical examination, left ventricular ejection fraction, okay, and then the MUGA scan. Those are the things we recommended. So this thing, when do you do? First you do baseline prior to initiation. Every 3 months during the treatment you do the whole thing. Upon completion of treatment also. Every 6 months for at least 2 years after completion of the treatment. So the main thing, MUGA scanning. Why do we do, instead of the echocardiogram, what additional information we do like a MUGA scan? What is MUGA scan? It's a minimal invasive nuclear imaging technique using the technetium erythrocyte labeling, okay? The advantage of MUGA scan is very, very accurate to look at the left ventricular ejection fraction, okay? It also, you can compare the previous scan results very accurately. Those are the accuracy and reproducibility. When you think about scanning in the cancer patient, looking at the heart, pick MUGA scan, okay? And the new diagnostic modalities are available coming up, speckle, tracking, echocardiography, a sensitive and a promising test we can use, and the new other cardiac MR is also considered the gold standard for cardiac structure and cardiac function. So alternative cardiac monitoring, again, left ventricular assessment is the most important suspicion of the heart failure. You have to measure the baseline and some of the risk factors, like if they're older than 50, they already have antihypertensive treatment, BMI, and all of this like high risk. And serial monitor cardiac function, we already talked about increased vigilance in the patient greater than 60. You always in patient with metastatic disease, and if they have like immediate like a troponin concentration, if it is high also. What are the biomarkers kind of important? Like, of course, troponin, BNB, C-reactive protein, myeloperoxidase, immunoglobulin E, and suppressor tumor genicity 2. All of these markers have role in the prognosis in this patient. Treatment, cardiac dysfunction. How do you treat it? Main thing, we already talked about. The most significant is like about the ejection fraction or left ventricular function. So the normal treatment is, you have ACE inhibitor, beta blocker, diuretic, and aldosterone receptor antagonist. Those are the main usual therapy you have to, but early recognition and look at the other causes or correct the arrhythmia. To monitor for arrhythmia also very important. These are our references. Thank you so much for watching our presentation. We'll be back with another presentation soon. Please subscribe to our channel.